Hello beautiful people, good day and welcome to this video for today. Okay, now do you know that poor oral hygiene can lead to cardiovascular disorders and respiratory infections? Now in today's video I'm going to be telling you the 6 negative side effects of poor oral hygiene, and towards the end I will tell you how poor oral hygiene can lead to cardiovascular disorders and respiratory infections. So please hold on and watch this video with me to the end. I'm sure you are going to learn something. Now let's get into business. First of all, poor oral hygiene can lead to what we call halitosis. Halitosis is generally referred to as mouth odor or bad breath. Okay, now poor oral hygiene, when you don't brush your mouth every day, when you don't brush your mouth over a long period of time, there is going to be what we call the multiplication or the continuous reproduction of the bacteria in your mouth. And then when they continue to grow and multiply, they release this stenching odor that keeps smelling in your mouth. So please, if you don't want to have mouth odor, if you don't want to have bad breath, make sure you brush your teeth 2 times every day. Now, next is what we call the calculus buildup. Okay. Now, the calculus buildup simply refers to the presence of other materials on the surface of your teeth and the gums that are not healthy. They are not supposed to be there. Okay. And then these materials build up as a result of the food debris that you eat. Now, when you eat food, there are certain parts of the food that hang on your teeth or in between your teeth. And then when you don't brush for a long period of time, these materials build up, they solidify, and then they become strong. And then when they become strong, they lead to what we call gum disease. Okay, now this build up is what we call the calculus. First of all, it starts from what we call the materia alba. It then leads to plaque, and it leads to calculus. Now sometimes if you've not brushed your teeth over a long period of time, when you put your fingernails on the surface of your teeth and you just scratch, you find out that there are some white materials on the surface of your teeth. That is what I'm talking about, and that is as a result of poor oral hygiene. Now, next on the list, we have the pain and discomfort. Okay, poor oral hygiene can also lead to pain and discomfort. When you don't brush your teeth 2 times a day, when you don't maintain good oral hygiene, definitely at some point in time, you are going to experience toothache. You are going to experience some discomfort from your own mouth. Okay, and this is because you don't take good care of the mouth, you don't treat the mouth as it should be treated, and you're not keeping it clean the way it wants to be. Okay, so please make it a habit to clean your mouth, make it a habit to brush your teeth 2 times a day to avoid this pain and discomfort. If you have ever experienced toothache, I'm sure you know what I'm talking about. Toothache is not a pleasant experience at all. Now, next is what we call the gum disease. Okay. Now, these gums are those pink materials that hold your teeth, that pink part of your mouth that hold your teeth. Now, if you don't brush your teeth regularly, if you don't maintain good oral hygiene, your gums are also going to be infected. Okay. And then there is a stage to this gum disease. We call it, it starts from the gingivitis, and then it leads to periodontal pockets, and then it leads to periodontitis. Periodontitis is a severe form of gingivitis. Okay, now all this starts as a result of poor oral hygiene. When you don't brush your teeth 2 times a day, your gums will start getting infected, and then when it gets infected, it will cause that pain, and then it will actually lead to this gum disease because your gums will be infected, and then the infections will continue to grow and grow and grow and lead to further complications. Now, next on the list here, we have the cavities or caries or tooth decay or tooth hole, depending on how you call it. But this simply refers to the fact that if you don't brush your teeth regularly, your teeth is going to reduce in quality. Like the strength of your teeth is going to reduce, and it is going to start decaying on its own, and it will start developing holes inside, and then inside these holes, bacteria and microorganisms will continue to grow, and then before you know, your teeth will decay. Like it will literally decay, and it will start breaking off on its own. All right, and all this is as a result of poor oral hygiene. When you don't brush your teeth regularly, your teeth will decay. Your teeth will develop holes in them, and then these holes will cause you pain and discomfort. These holes will serve as a hideout for microorganisms and bacteria, and then that is actually not a pleasant experience. Now, having talked about tooth caries and tooth decay, the next thing that can possibly happen is the tooth loss. Yeah. Now, if you don't take good care of your teeth, all these points I mentioned, at some point or the other, they are going to lead to what we call tooth loss. Or then the pain and discomfort is going to become so excruciating and so discomforting that you will visit the dentist yourself and tell him, hey doctor, remove my teeth. And I'm sure you don't want it. You don't want to live without the teeth in your mouth, because if you lose the natural teeth in your mouth, you're going to be using artificial ones, and then nothing artificial can be good compared to the natural. Okay, so please take good care of your teeth. If you don't want to lose your natural teeth, if you don't want to experience tooth extraction, if you don't want to go a dental loss. Now, finally, as I said earlier on in the beginning of this video, poor oral hygiene can also lead to what we call cardiovascular disorders and respiratory infection. Now, cardiovascular disorder simply refers to the disease of the heart, okay? Now, this happens because your heart pumps blood to your teeth, and then your teeth returns that same blood back to the heart. So when the teeth is infected, when there is an infection in the teeth, or there is caries in the teeth, and then it returns that infected blood back to the heart, your heart is going to get infected. And then when your heart gets infected, your whole body is affected. Okay? And then poor oral hygiene can also lead to what we call respiratory infections. Okay? Respiratory infection simply refers to the infections of the lungs and other tissues that are responsible for your breathing in and breathing out. And I'm sure you know that whatever affects your breath, your breathing in and breathing out affects your overall health, overall well-being. Okay, so please take good care of your oral hygiene if you don't want any of these negative effects to happen to you. I believe I've done justice to this video. My name is Joel Jethro, and I will love to see you in my next video. Please subscribe.